Thank you to everyone that is joining us today. My name is Aaron, and today we are talking to Dr. Robb Rehberg. Robb is a certified athletic trainer and a nationally registered EMT. Throughout his career, he has served in the fields of athletic training, sports medicine, and emergency care. He is currently a professor of sports medicine and athletic training at William Patterson University in New Jersey, and is a senior medical advisor and director of game day medical operations for the National Football League. So Robb has authored 3 textbooks, if I have that right, in the field of sports medicine, and has edited over a dozen first aid and CPR and emergency preparedness books and training programs. His latest with Human Kinetics is Sport First Aid 6th edition. And we're going to talk a little bit about that today, and just sports injuries, how to care for them, and kind of get into that discussion. So again, thank you so much for your time. I really do appreciate it.
Yeah, I'm glad to be here. Thanks, Aaron.
So like I mentioned, you have a lot of experience in the field, but I'm interested, where did it all start? What got you interested in athletic training and sports medicine and this whole career?
Well, it started with becoming an injured athlete. Okay. And spending a lot of time in the athletic training room. You know, back when I was a high school athlete, there weren't many schools that had athletic trainers, but I was fortunate to go to a school that did have one. And, you know, before I spent a lot of time with that athletic trainer, I thought I'd end up being a police officer like my dad. And so I thought that would be my vocation. And you know, I played football, and I had wrestled for a little bit, and then I had thrown shot put and discus, and I had injured my shoulder and my ankle and other things playing football. And I remember the athletic trainer one day saying, "You spend so much time here in the athletic training room, you might as well just become an athletic trainer." And I thought about that, and I said, wow, that may make sense. So, you know, I was really always fascinated by what she was doing in the athletic training room and on the field and everything else. And so my senior year, I was able to create an individualized kind of independent study class on athletic training with her. And I said, I think I want to do this for a career. And she said, well, if you're going to do that, then there's one place that you need to go, which is Westchester University, which is where I ended up going to do my undergrad. And that was it. I was hooked. And so I was very fortunate at a very young age to find a profession that really meant something to me, and that I really loved, and have not regretted it one bit my whole career. So
I think that's such an interesting story to hear that from, you know, athletic trainers, physical therapists, you know, and athletes end up getting injured and go through that whole process, and probably appreciate it even more so on that end. So I guess I highlighted kind of where you're at right now, but like, where did you get your start? I mean, I'm guessing you didn't just jump right into these positions here.
Yeah, you know, I think any profession this is true, but especially for, you know, for athletic training or people that work with sports, it's about relationships. And you know, in my early years as an athletic trainer, I had a real interest in emergency care, okay. Which is kind of obvious, you know, based on the books and other things that I've done. But you know, where I really got my start was I saw a particular issue that I thought needed fixing, and so I got very active instead of, you know, be complaining about it. You know, the issue back then was about how to manage you know, an athlete who had a potential emergency, especially spinal injuries, and there seemed to always be, you know, this consternation between EMS professionals and sports medicine professionals about the best way to manage somebody who had a helmet and shoulder pads on with a spinal injury. And so and this is just one example of many throughout my career, but I ended up writing an article about it in a magazine called the NATA News, which was published by the National Athletic Trainers Association. And a few days, a few days after it was published, it was the first thing I ever published. I got a phone call by someone named Ron Corson, who is a Hall of Fame athletic trainer and someone who I've enjoyed a really great and long career and friendship with now. And he was putting on a program on emergency care in athletic training, and we kind of hit it off from there. And I was really thrilled that someone, you know, something that I had done resonated with somebody. And one thing led to another, and Ron ended up being in charge of a lot of the sports medicine aspects of the 1996 Olympics, and invited me to come work He was putting a team together for the Olympics, and I got to meet a number of people there, and got more involved in the profession, met more athletic trainers who were doing really interesting things around the country. But that's just one example of many how, things snowball. And if you love what you do, and you love to devote time to it, and you want to help make the profession better and help, care of athletes improve, you work with other people and you make these connections, and that's kind of how you elevate through the profession, if
Okay.
you will.
So like we mentioned, and kind of you described your progression a little bit. You are a senior medical advisor to the NFL, director of game day medical operations. First of all, what does that mean for you? And I think for the listeners, we watch the NFL on both Sunday, Monday, now it's Thursday, Saturday, multiple days. And we see it from that perspective. So what is life like for an athletic trainer or a trainer with the NFL?
Well, my experience and what I do is different than what you see the athletic trainers that work for the teams do. And so, every NFL team has a staff of athletic trainers, and those men and women are the ones that are working day in and day out to prevent injuries and rehab the injured athletes and provide game day medical care. And so, in season, that's a 7-day-a-week job for them, and it is long hours, and they are very highly trained. And the good thing is that we see that, most staffs have several athletic trainers. Years ago, it used to be maybe one or two. And so, their job is not much unlike, the job of athletic trainers at other levels, whether it's high school or college, but it's just a lot more magnified and with highly paid athletes, and it's a little bit more of a pressure situation. But my job in particular has kind of evolved. And I feel fortunate that the job that I do with the league, like many athletic trainers right now, that are doing jobs that didn't exist 5, 10, 20 years ago. And so I got my start as an athletic trainer spotter. And I was one of those athletic trainers that works, during the NFL games, up in a specialized booth looking for injuries, primarily head and neck injuries and concussion or potential concussion. And once again, was involved there. It was, a program that did not have a lot of formalized education and training around it, and I saw an opportunity to make things better. And it was right around the time when Dr. Alan Sills, who's the NFL's chief medical officer, had come on board, and he had always told anyone that he's an open door, and if you have ideas or suggestions, to call him. So I decided to do that, and I said, I think I have some ideas on how we can improve this program, and one thing led to another, and I began to oversee the athletic trainer spotter program, and then it kind of snowballed after that. Every 3 or 6 months, Dr. Sills would say, hey, I have this other project. I don't know if you have the bandwidth to do this, but all in all, it ended up to where I am now. And, the senior medical advisor part of it, I help with the coordination of our NFL medical committees, our head, neck, and spine, and musculoskeletal committee, and general medical, and research and innovation. And those are the committees that really do the work in terms of looking at ways we can prevent injury and lower injury burden, and find ways to provide better care for players at all levels, not just in the NFL. And then on the game day side, I still oversee our athletic trainer spotters and our injury video review operators. And I also provide support for our international series games. We're having a growing number of games in other countries. I think we have 7 coming up this year.
Okay.
And then I also help with our emergency preparedness in terms of our emergency action plan training for the clubs, and help Dr. Jim Ellis, who's our medical director for emergency preparedness at the NFL, help support that program as well, and just a number of other game day related issues that come up from time to time during the season.
Okay, very interesting. Now, you mentioned specifically, head, neck, spine injuries. We know that, especially in football and some other sports too, that is a pretty big topic. So I guess for all levels, whether we're talking about youth, high school, college, pro, what are some things that coaches or trainers can do to try to minimize that risk of those injuries?
Yeah, well, there's a lot of things that we can look at that are very simple and easy to kind of implement, right? First of all, we want to make sure that, as an athlete, it's really important to warm up and cool down. I think every athlete should know that, and hopefully they've been taught that. strength and flexibility is always a focus. Ensuring that there's proper technique, and of course that's on the coaches as well as the athletes. Um, um, Hydration and nutrition are really important. Making sure that you're properly hydrated, you're putting the right fuel in your body so that you can achieve peak performance. And that does have an injury prevention component to it. Using the proper protective gear, making sure that if you're a wrestler, you're wearing your headgear. If you're a coach and you're coaching football, that players have the right equipment, that it's been fitted properly, that it's been reconditioned. Before I mentioned hydration and nutrition, but sleep is another one, right? Okay. Getting proper sleep. I think that we're learning, athletes are learning more and more now with the growing body of evidence about the importance of sleep and recovery. We don't approach training for a sport the way we used to, right? Where it was just you went 100 miles an hour as long as you can until you're completely exhausted and fatigued, and you'll do it again tomorrow. Triple, 3 times a day practices for sports camp, in the preseason. The body needs time to recover, and if it doesn't recover, it's not going to be in a position to perform at its highest level. And so, sleep and recovery are important. And then, for coaches in particular, making sure that you have an adequate practice plan, that you're tailoring a practice with the level and the ability level and the competition level of the athletes involved, right? You can't train and structure a practice for a Division I a youth program the same way you would a Division I program. And so you need to know your athletes. You need to know what level it is and progress and become acclimatized to not only the activity but also the environment. So those are all I think important areas that coaches and athletes need to take a look at. Of course, relying when there are injuries, or even the prevention of injuries on healthcare providers, primarily athletic trainers, if you have access to them, is really important. I think I've, in general, hit upon most of the really big issues that can really help reduce injury. But okay. Those are pretty much the basics there.
And we know about acute and chronic injuries. Obviously, those are very different. Maybe you can explain to some people who might not know the difference exactly between acute and chronic injuries. But I was going to ask. I think there is some confusion between acute and chronic injuries on whether to apply ice or heat to help remedy that. So, can you clear that up a little bit? What is the correct protocol when it comes to that?
Yeah, sure. Well, to address that first part, we consider an acute injury is a sudden injury that just happens, right? And you're running and you change direction and you pull your hamstring, and now you have a hamstring strain. That's an acute injury. It's a sudden injury, right? A chronic injury is something that is a known condition that kind of nags over time. And so, examples like that might be, it might be a tendonitis, in a certain tendon, or we've used the term, or you've heard the term, shin splints or medial tibial stress. That's another example of something that is a chronic injury, or patellar femoral pain, pain in your kneecap area. So those are kind of more chronic. Low back pain is something that can be chronic because it seems to just be nagging in there all the time. But when it comes to ice versus heat, anytime we have an acute injury, something that is suddenly something that happened right now, ice is the best modality to use over heat, because what we're trying to do there is not only kind of slow down the metabolism, and again, we're talking about right when it happens, slowing down the metabolism and providing a little bit of pain relief, and trying to control that swelling. For the first, generally as a rule for first aid for acute injuries, we really say to use, ice for at least the first 24 to 48 hours, or even 72 hours, right? We don't want to introduce heat to an acute injury because it may increase blood flow. And remember, with an example, let's say a muscle strain. When there's a muscle strain, there are broken muscle fibers and also broken blood vessels. We don't want to increase the swelling by putting heat on it, because heat is going to actually open up those blood vessels, those capillaries a little bit more, and we don't want to promote swelling there. Heat can be used for those chronic injuries, especially, I'll use the example for if you have low back pain, or if you have shoulder a shoulder injury, you have a sore shoulder, and it's not something acute where it is new damage to the body. Heat can be used and can be effective in helping relieve some of that pain after a workout or after physical activity. So again, most of the time we talk about using heat for something that, or all the time when it's a sudden injury, but those chronic injuries that kind of nag over time. There are situations where heat can be beneficial to kind of help with the pain relief and overall therapeutic effect.
Okay, this makes me think of a follow-up question to that. So there's the idea, or we've learned, when we're going through the rehab process, maybe that's a tissue injury, to kind of warm that muscle so that more nutrients, more blood flow can get to that area. Is that still accurate in your experience? And is there a difference between natural body heat and applying external heat when it comes to that rehab process?
Well, yeah, you certainly want to be, when we talk about warm up, right? We're not just talking about, getting yourself, getting the juices flowing, but we are trying to get increased blood flow to the organs in the body and the muscles in the body, because more blood flow is going to bring more nutrients to the muscle. It's going to keep the muscles and the organs a little bit more hydrated as well. So when we talk about proper warm up, it's not only about the exercise that you're doing; it's about about getting that warm blood flow throughout the body. Now, warm up, from body heat versus artificial, I don't know that. In terms of an injury prevention perspective, that we need to be putting moist heat packs on large muscle groups before every exercise. But especially doing activities that is going to increase your body temperature slightly, or at least get that blood flow to that area. That's really kind of what we're talking about more, and keeping that area, keeping the blood vessels in that area flowing. So an example I might use is, let's say you're a pitcher, right? And oftentimes you'll see pitchers wear, a sleeve or something on their shoulder or their elbow to kind of keep it warm in between innings, right? One of the things that we're trying to do is, if it is a colder environment, we're trying to avoid some of the constriction of those capillaries, of those smaller blood vessels in that area, that might occur because they're getting cold, right? We want to keep that area not necessarily warm, but most importantly from losing any heat, any body heat, so that we can we can keep that blood flow there. We can keep the tissue healthy, and keep the joint and moving, the muscles moving, so that they're able to to move at peak performance.
Okay. Now, speaking of heat, we unfortunately see a number of heat-related illnesses. Obviously, more during the summer months. I think we hear in the news about it, maybe more so in football, but it can happen in any sport. I've seen it in tennis, football, baseball, softball, any sport that you're probably playing outside. What are some things athletes and coaches can do to prepare for situations like that, and hopefully completely prevent those heat-related illnesses?
Yeah, and by the way, I might add, it can even happen in the wintertime. Remember,
Okay.
Sometimes you have very warm environments. Sometimes, wrestling room might be very hot. It's certainly discouraged that, I remember when I was in high school, that coaches, to try and make weight, they'd have players wearing rubber suits, which is not something that we should be using to try and drop water weight. Certainly not a recommendation, but anyway, to try and preventing heat illness is really, really important. And it's something that needs to be on the mind, not only of the coaches, but the athletes themselves. And so a couple of really important factors to consider. Number one is acclimatization, right? If you are going to be participating in a warm environment, it is really important to give your body time to acclimatize to that warm environment. And many states now have, at the high school level, have enacted rules about heat acclimatization in those warmer months, and providing a ramp up. And what we mean by that is getting your body used to operating in that heat, and in that heat potentially with a lot of equipment on, right? If you take, for instance, football, right? If it's August and you're going to be suddenly practicing, twice a day or 2 times a day in very hot, humid environment, as a coach, you have to kind of think about a couple of things. One is, what has that athlete been doing all summer? Were they sitting in the air conditioning playing Xbox? And now suddenly we're thrusting them into, a full-blown practice with helmets and shoulder pads and everything else. That's going to increase your risk for heat illness, right? So we need to make sure that those athletes have an opportunity to acclimatize themselves, for their bodies to become used to exercising, number one. Number two, be exercising in warmer environments, and not only warmer but humid environments where it's harder for the body to cool itself. And then also acclimatize to doing those things in those warmer environments with equipment, if they're wearing equipment such as helmets and shoulder pads, or even, it doesn't have to be football. It could be just wearing, some type of protective headgear like in lacrosse, or or more or less breathable, a less breathable uniform, if you will. So acclimatization is really, really important. Timing and intensity of practices too. It's not a wise idea to have the hardest practice, at the very middle of the day, where it's going to be the hottest and most humid, and because it's only going to increase people's chances of heat illness. And that can be true whether you're a new athlete or an elite athlete. Planning training and practices at times where it's going to be cooler and perhaps less humid throughout the day are really important. Hydration is key. Staying hydrated is really, really critical for people who are physically active and people who want to perform best. And hydration is a continuous state, right? We need to be hydrated all the time. A lot of times, I'll say, well, I'll be fine. I'll just drink a Gatorade or two before I go to practice. But if you remember Popeye, remember the Popeye cartoon when, he'd need strength and he'd pop a can of spinach and suddenly he has muscles. Hydration
Right.
and drinking water or an electrolyte drink is not like Popeye's can of spinach, right? You can't just drink one and expect to be hydrated. You have to be hydrated on a regular basis. You need to be drinking fluids, or water, clear liquids, or an electrolyte drink, and doing it on a regular basis. Many people in our country are walking around in a state of dehydration, and we need to make sure that that when it comes to our athletes, that they are properly hydrated. So hydration, the practice timing, intensity, the acclimatization, having frequent breaks from practice, also making sure that there's enough time to have that recovery in between, harder parts of practice, and allowing time for fluid intake is really, really important. Wearing light colored clothing, considering when not to wear equipment if it's very hot out. Monitoring the athletes, right? You want to make sure, you want to keep tabs on your athletes, especially those who might be more out of shape or more overweight. And then having a plan, right? Making sure that if there is a heat illness, that you're able to identify it, recognize it, and provide immediate care, if something does happen. So
that makes me think of something when you're talking about, obviously hydration is very important. I had a tennis athlete actually a number of years back, that they found pickle juice shots, and they said that helped them during matches. I don't know, what's your belief on that? Is it does pickle juice help more than other, I guess, forms of hydration?
Well, pickle juice certainly is high in sodium, that's for
Right.
sure, and which is an electrolyte.
Yeah.
There have been some very limited studies that I'm aware of. There may be more that have studied pickle juice. I think there was a study that I seem to recall that was done with an NFL team a long, long time ago, and I can't cite the results of it. But honestly, when it comes to hydration, it's important to get the volume of fluid in that you need,
Yeah.
right? And not just, think about, well, I'll take a couple of shots of pickle juice and that's going to work. For overall health, and I'm not just talking about, about performance and physical activity and being a better athlete, but being hydrated in general is better. And, for your general health, not just your physical activity. So, relying on, and by the way, I've seen other snake oil out there about this will keep you hydrated or that, but getting in the habit of drinking water, drinking, an electrolyte replacement drink, if that's what you want to do, is really important for general health. The pickle juice, will it potentially have an effect? I really can't say. Again, it's been studied just a bit, and there are some people that swear by it, who I've met, but I think a better plan is to practice good hydration on a regular basis with the important fluids, again, water and supplemented with an electrolyte replacement drink. And when we say fluids, again, it really does mean water. We're not talking about caffeinated drinks or alcoholic drinks or anything else. Those actually can help dehydrate you.
Right.
But getting the right fluids in is important.
I don't know, maybe there was some type of a placebo effect with her, and she believed that it was helping more than other. But I don't know. I think that's a constant struggle for trainers and coaches to constantly remind athletes to stay hydrated. Because, like you said, there are probably more people in the United States than we would like to think that are walking around dehydrated. So
Yeah. Yep.
always something to definitely consider. So. When we're talking about, you mentioned earlier the importance of having an athletic trainer or members of the medical staff on site. We know that that's not always possible, especially at the high school level. I mean, there might be one athletic trainer for an entire school district, and they obviously can't be everywhere all at once. So what are some things coaches can do? And I know you spoke on this a little bit already, but what are some things coaches can do to stay prepared or I guess kind of handle cases of injury if there isn't an athletic trainer on staff?
Yeah, well, first, before the injury occurs, I would strongly encourage coaches at the high school level to be strong advocates for getting an athletic trainer at their institution, at their school, if they don't have one already. Coaches, should not be put in the position of being a healthcare provider. No different than putting somebody in a coaching position who has very little knowledge of the sport, right? So we should have healthcare providers who are there to help prevent injuries and certainly have the requisite knowledge and skills and certification to help with those things. And coaches, I think coaches recognize that. So coaches need to be good advocates to get the right healthcare team there. However, like you said, athletic trainers can't be there all the time. There could be practices where there is no athletic trainer, even if there's one employed there. My first job as a high school athletic trainer, our football field was at a different school than the high school where all the rest of the practices and games were going on. So there are going to be times, athletic trainer or not, where coaches are going to have to address injuries and illnesses on the field. And so the best way a coach can be prepared is, number one, make sure that you're trained, right? In most states, coaches need to be trained in CPR and first aid. And it's important to have that training. The book that you just mentioned before that we just released, the 6th edition of Sport First Aid, is intended for coaches, specifically high school coaches, and provides enough information so that it's not trying to make you a doctor or a nurse or an athletic trainer, but provides you the right information so that you can provide that immediate care for somebody who's suddenly ill or injured until there's additional help that can arrive. So making sure that you have that training, making sure that you have a plan. Every facility and anywhere sports is being played, and when I say anywhere, that means in the gym, on the field, on the road, you need to have an emergency action plan. And that emergency action plan needs to be a plan so that you know what to do if there is a medical emergency that needs to be addressed. And it outlines the steps that everyone who is a stakeholder will need to take. And and sometimes very simple things about how to call, when to call 911 or call for help, the location of the nearest AED or automated external defibrillator, where the medical kit is, how to contact the parents, how to get the athletic trainer if you have one and they're not there. And that emergency action plan it needs to be in place. It needs to be specific to the venue where you're participating. So for instance, an emergency action plan for the soccer field is going to be different than than the wrestling room or the volleyball court. And making sure that plan is known by the entire coaching staff, anyone else who may be involved in the response there, including school administrators, custodial staff, getting the local EMS involved, of course, the athletic trainer if there is one, and practicing that emergency action plan to make sure that that plan works. And so Getting back to the athletic trainer part of it, those are things that athletic trainers do routinely and can very easily implement an emergency action plan, at a school. But at a coach level, knowing what to do in an emergency, certainly knowing what not to do, and those are things that you learn through learning first aid and CPR, are really, really important, and making sure that you know what the plan is, and also making sure that you have the right equipment, right? Make sure you have a first aid kit, and that kit is stocked with the supplies that you need. Having an automated external defibrillator is critical, right? Sudden cardiac death is the number one cause of death in youth athletes, and making sure that you have an AED on site and that is readily available within 2 minutes or less is critical. And that's something else that if you don't have it as a coach, you should be a strong advocate for it and help to fight to get those devices. It's encouraging to see a lot of states now have laws requiring defibrillators be present for athletic events, but I don't think that we're 100% there yet. So anyway, those are all different things that coaches can do to be prepared.
Definitely, all great information. Definitely an important topic that I think needs to be discussed a lot more. I think we talk so much about training and practicing. We do what we can through training to try to prevent injuries, but injuries happen, so we need to be prepared for knowing how to handle them when they do happen. So I want to be respectful of your time. I completely appreciate the conversation. Like I said, tons of great information in this today. Like Dr. Rehberg just mentioned, if you're a coach or athletic trainer, make sure that you're educating yourself. Like you mentioned, we do have the Sport First Aid 6th edition now. There is a certification course that goes along with this. You can find it on the Human Kinetics website, or actually it's coacheducation.humankinetics.com. So definitely take a look at that. Like I said, Dr. Rehberg was responsible for editing this book and helping with that education program. So within that course, you're going to find guidelines like he just mentioned on administering CPR, treating concussions, dehydration, heat illness, a lot of the things we talked about today. So definitely take advantage of your resources so that we can, keep our athletes healthy. So thanks again, Dr. Rehberg. I really do appreciate it. I will give it back to you for the last word here. If you have any take-home message, maybe for the coaches listening, and maybe let them know how they can continue learning from you and at least keep up on the most recent information.
Yeah, well, first, thank you very much, Aaron. This has been a pleasure. I always enjoy talking about this stuff and happy to discuss these things with you. All great questions. And, for coaches that are out there, now more than ever, I think coaches have a lot of responsibilities. You're wearing a lot of different hats. You're not only a coach, but you're a travel agent and a surrogate mother and father and counselor, but we don't want you to have to feel like you need to be a doctor or a nurse or an athletic trainer as well. So there are very simple things that you can do to kind of address and know what to do in an emergency, and learning first aid and CPR, making sure you have a defibrillator and other supplies are probably the best ways to, and having an emergency action plan are the best ways to do that. So if you have access to an athletic trainer, they're the ones who can help you achieve those goals. And if you don't, I strongly recommend, advocating to get an athletic trainer so that you can have the support that you need if you do have one of those significant injuries or illnesses that occur on the field.